extraordinary times of health threats and injustices, the resilience of our partnerships in advancing health has never been more important. Chevron has prioritized the health and well-being of our workforce and the communities where we operate. We began our HIV journey in 1980s when we were seeing our workforce and communities directly impacted by the virus. Our response as a corporate citizen was and continues to be holistic, multifaceted, and collaborative. Through our partnerships, we bring data-driven global experience, leadership, and financial resources to assist in addressing the health risks having the greatest potential impact on our colleagues, their families, and communities. One of the world's leading infectious disease specialists is Professor Eric Goosby from the University of California, San Francisco. Ambassador Goosby's leadership and his commitment to public-private partnership has a profound impact on local community health and beyond.
In that first decade of response, from 81 to 91, public-private partnerships took a disproportionate role in presenting a portfolio of services to large epicenter cities in the United States. It became a buttress of support. As you can remember, the first federal dollars made available for HIV was in 1991, and that was Ryan White, and that was after years of advocacy. It left city responses dependent on identifying local partnerships with private sector entities that could help augment the limited funding in mounting a response.
Partnerships are central to Chevron's social investment and local community health strategies. And in the San Francisco Bay Area, we are fortunate to work with some incredible organizations that provide groundbreaking prevention, testing, and care services to the most marginalized and vulnerable populations in our communities, and how partnerships have expanded the reach and scope of the life-saving services they provide every day.
San Francisco Community Health Center provides high-quality primary medical, dental, and behavioral health care focused on LGBTQ communities, people of color communities, and the homeless community. We're based in the Tenderloin neighborhood of San Francisco and have a full range of specific and tailored HIV programs. While we are supported by city, county, state, and federal funders, the importance of engaging the private sector has been so crucial to our mission. And most recently, as we've responded to the challenge of COVID-19, Chevron has been there for us, helping us purchase desperately needed personal protective equipment and support us to find new ways to reach these communities and individuals who can't access typical health services.
Chevron's support of Calvet has helped us to maintain many of our programs, as well as stay within the mission of the agency, which is to provide accessible health care, HIV testing, street outreach, and other supportive services to those who are marginally housed or disenfranchised. More recently, we are now providing shower services throughout Oakland and Contra Costa County. The need for these services in these days of the corona pandemic has never been greater.
The mission of San Francisco AIDS Foundation is to address the health disparities experienced by people living with and at greatest risk for HIV. We do that by creating inclusive communities, giving people a voice, and promoting health and wellness. Our partnership includes Chevron investing in our mobile testing unit, which allows us to bring HIV testing and other sexual health services to community who do not have access to these essential services. And we're so proud to have their partnership in all that we do.
Here at PRC, we are in the business of changing lives, transforming lives, living with HIV, unemployed, and homeless. Many of our clients are people of color. In San Francisco, African Americans make up 5% of the population. They also make up 37% of the homeless population. And in the 10 leading causes of death, African Americans are the highest in 9 of them. It's clear systemic change is needed across all levels of our government and in the healthcare system. And we couldn't do this work without partners like Chevron.
One of the partnerships we are most proud of is our long-standing partner and collaboration with the National AIDS Memorial. Our shared goals around education, reducing stigma, and social justice are few values that align and deliver some impacts to our efforts. And if you visit the Grove in San Francisco Golden Gate Park, you will find a moving tribute to the people we have lost to HIV. Names of people that include Chevron's own staff and family members. In remembering those who went before us, we can find strength to unite to end AIDS once and for all.
The National AIDS Memorial stands as a marker in the national landscape to the tragedy of HIV and AIDS. Last year, the National AIDS Memorial acquired and will be the stewards of the AIDS Memorial Quilt in perpetuity. Bringing these two organizations together, these iconic memorial features, will allow us to tell the stories as well as to take the quilt, which is one of the most powerful social justice teaching tools, across this nation and around the world. As a person living with AIDS for over 2 decades, I never thought that I would have to live through one pandemic, let alone a second. They are very different in many ways, but there is a thread that we must pull through that does connect the two pandemics. And unfortunately, that thread is rooted in stigma and discrimination. I believe that there will be positivity that comes out of the COVID-19 crisis and brings about profound change in our society, as the HIV and AIDS crisis did as well.
Whether we are fighting AIDS, tuberculosis, and malaria, or COVID-19, public-private partnerships will continue to play a central role in our ability to bring these epidemics under control. These partnerships have evolved and will continue to do so, going well beyond just funding.
So Chevron has a unique history in, one, responding to the needs of their employee population and making those services available to the patient, the employee, the employee's family, and the community around it. It's a good example of public-private partnership that's resilient and has endured because of a mutual interdependency. It had a benevolent aspect to it, but it also had a business model that needed the other to complete it. So I think we found in public-private partnerships, the ones that included the business model of the company and allowed those to be incorporated in what we built are the ones that endured.
The resilience of partnerships and that of the partners we have just met shows just what we can achieve when we work together. We have faced and overcome health threats from the past and will always need to address the current and future threats. These and the ever-present threat of economic uncertainties have not deterred a collective focus on addressing HIV/AIDS. At Chevron, our health efforts aim to empower individuals and communities to prevent disease, support health system strength, improve health equity and security, and build prosperous communities. As we join together for our first virtual Global AIDS Conference, we look forward to sharing together our successful practices and lessons learned from the past that can move forward our collective commitment towards getting to zero. Thanks to our partners and their continued commitment and solidarity towards addressing the critical issues for the advancement of public health and community prosperity.